Okay, it looks like it's top of the hour. Thank you everyone for joining us today for our webinar. Just a couple things before we get started. Feel free to submit your questions via the questions panel throughout the webinar, and we'll try to get to those at the end. And your certificates should be available on your account on Friday by logging in. Jonathan, if you're ready to get started, go right ahead.
Great. Thank you, Kim. I'd like to thank Madila for inviting me to present at today's webinar. Excited to present this information, and hopefully it's useful and beneficial for all the attendees. Also want to thank the attendees for joining and your interest in learning about milk banking. So just a quick overview of what we're going to talk about, and then we'll get it into specific objectives. But want to talk about the importance and benefits of human milk banking, specifically pasteurized donor human milk. I have no disclosures for this. So I thought I'd start out with a little bit about myself. These are pictures that I wanted to share with you on this webinar. I have 3 daughters, and they're all grown, obviously, and they live 2 in Des Moines and 1 in Washington, D.C. area. I have 2 granddaughters. They are in Des Moines, and I have a third one. Third granddaughter on the way, and she is due in November of this year. All of my daughters were breastfed and are healthy and happy living their lives. Our other kids are 4 pups that you see here. My wife is holding one of our sheep dogs, and my wife and I have a soft place in our heart for special needs animals, and all of these animals have some type of special needs, whether they're deaf or blind or have some type of neurological disorder. But these are our kids that keep us busy on a day-to-day basis. I'm the executive director at San Jose Mother's Milk Bank, and I've been with the milk bank since August of 2019, right before the pandemic started. My background is in blood banking, and there are a lot of parallels between blood banking and milk banking. And my experience at blood banking has really benefited me in learning about the milk banking world and changing some of our processes internally to make sure that the products that we collect, produce, and distribute is safe. So a quick overview. I'll give a brief overview of the history of milk banking. I thought it'd be important to talk about how it all started, and then talk a little bit about the North American and European milk banking associations who support these nonprofit milk bank organizations. I'll give some information so you gain an understanding of the applications of pasteurized donor human milk, and information on understanding and how donors are obtained and how the milk is processed. And then lastly, learn about ways you can help raise awareness of milk donation. At the core of my presentation is my hope that the information helps to raise awareness of milk donation to the level of blood donation. And I'll talk a little bit about that later in my presentation. So there's a lot of information in this slide, but I'll just give some more details. In North America, support for donor milk banking for premature and ill infants has been around for over a century. The earliest identified milk bank was established in Vienna, Austria. The first milk bank in the United States was established in Boston, and that was actually called the Boston Wet Nurses Directory. And what it was a small group of women who were providing milk to infants in the hospitals. These women were screened for health to make sure that they were healthy, make sure that the milk was healthy for the infants that they were providing the milk for. And in 1919, the Boston Wet Nurses Directory was actually converted to a donor milk bank. So they were providing donor milk for more babies. In 1970s, we saw an increase in donor milk banking. That was attributed to increases in breastfeeding rates and advances in neonatology that led to increases in survival rates for sick and very premature infants. During the 70s, medical facilities, volunteer community organizations of breastfeeding women established distributing banks across North America. And Canada established their first milk bank in 1974 in Vancouver, British Columbia. In 1980, the World Health Organization and the United Nations Children's Fund supported the use of donor milk as the first alternative. The number of milk banks grew by the early 80s. There were actually 52 active milk banks in North America in the early 80s. And at the same time, there were safety concerns. Safety concerns arose in the early 80s regarding the transmission of viruses such as HIV and diseases such as hepatitis. This concern really impacted the donor milk banking industry and tissue industries. And by 1981, there were only 5 milk banks in operation. So soon after that, in 1985, the Human Milk Banking Association of North America was formed to support the remaining milk banks. And what they did is they developed screening and processing guidelines to ensure the safety of the milk. The first Hembana guidelines were published in 1989. So a little bit about the Human Milk Banking Association of North America, Hembana. They are a nonprofit member organization, and it's a network of nonprofit donor milk banks across North America. Today, there are 31 active milk banks in North America, 3 in Canada, and 28 in the United States. Again, Hembana developed screening and processing standards to ensure safety. And a lot of those screening and processing standards are based on medical evidence. And it was created by a collaboration of other milk banks that all milk banks follow. Hembana also advocates for legislation and regulatory changes that support breastfeeding and the appropriate use and equitable access of pasteurized donor human milk. To give you an idea of the volume of milk distributed, the combined 31 milk banks under the Hembana umbrella provided over 9 million ounces of milk in 2021. And this is just a quick snapshot of where these milk banks are located in the US and in Canada. In Europe, the European Milk Banking Association was launched in October of 2010. They too are a nonprofit organization, and there are 281 milk banks across 30 countries in Europe. EMBA promotes milk banking in Europe and encouraged international cooperation between the milk banks of the countries in Europe. They published their consensus statement in 2019, and that was very similar to the standards that, or the guidelines that Hembana published. And it provides guidelines for European milk banks to follow to make sure that operations provide safe milk for the infants that they serve in Europe. And then a little bit about my milk bank. So San Jose Mother's Milk Bank, we are a nonprofit organization. We were established in 1974 to serve sick babies in the NICU. Our main focus when we were first established was to provide donor human milk for the NICU babies. We're the longest operating milk bank in North America, and we are a charter member of Hembana. We distribute over 800,000 ounces of milk annually, and that continues to grow year over year. Like Hembana, we're also involved in lobbying and developing legislation to support breastfeeding and use of donor human milk in California and neighboring states as well. So why are we talking about donor milk today? Human milk optimizes the health and well-being of all infants, but it's vital for infants born with prematurely or ill. An exclusive human milk diet provides protection against serious complications that can lead to longer hospital stays, multiple procedures, readmissions, lifelong disabilities, or even death. Up to 70% of mothers who have infants in the NICU born prematurely experience delays in production of milk. And there are several factors that delay the production of milk, and those include premature birth, cesarean section, medication use, diabetes, fertility treatments, and obesity. A mother's own milk is the best for her infant. And when mother's own milk isn't available, then pasteurized donor human milk is proven and supported as the next best alternative. Other infants outside the NICU also benefit from use of pasteurized donor human milk. For example, infants with acquired or congenital gastrointestinal or cardiac conditions, infants with severe allergies, or infants with immunological or malabsorption issues. So the use of donor milk has gotten great support from the medical community. In 2001, the American Academy of Family Physicians issued a position paper supporting the use of donor milk from Havana milk banks, and that support was updated in 2021, so just as recently as last year. In 2002, the World Health Assembly report, the Infant and Young Children Nutrition Global Strategy on Infant Young Child Feeding, advocated donor milk as first alternative when mother's own milk isn't available. In 2010, the Canadian Pediatric Society position paper endorsed donor milk as a recommended alternative, and they reaffirmed their support in 2014 and 2018. In 2010, the FDA Office of Pediatric Therapeutics national experts met, and they concluded with the endorsement of donor milk banking. In 2011, the U.S. Surgeon General's call to action to support breastfeeding called for the removal of obstacles to greater availability of safe bank donor milk for fragile infants. And in 2012, the American Academy of Pediatrics recommended, if mother's own milk is unavailable, despite significant lactation support, pasteurized donor milk should be used. They strengthened their position in 2017, emphasizing the safety of milk from recognized milk banks. So in the NICU, use of pasteurized donor human milk is associated with increased survival rates and lower rates of infections, sepsis, retinopathy of prematurity, which is the major cause of blindness in premature infants, bronchial pulmonary dysplasia, which is a serious lung disease, and GI complications. Because of the many benefits of pasteurized donor human milk, it's become the standard of care in NICUs. Total parenteral nutrition, a little bit about that. Infants with congenital or acquired gastrointestinal anomalies face surgeries. And TPN, which is IV feeding, is a procedure used to make sure that the infant is getting the nutrition they need. So when TPN is used, it bypasses the usual process of eating and digestion, and prolonged use is associated with infection and complications. Human milk feeding is tied to quicker tolerance of oral feedings, and it reduces the days that an infant is on TPN. So human milk is better tolerated in infants with complex GI anomalies, and pasteurized donor human milks improved outcomes and less time on TPN for infants with short gut syndrome as well. Another benefit of pasteurized donor human milk is that it contributes to the rate of maternal breastfeeding in the NICU. The use of pasteurized donor human milk in conjunction with mom's own milk, if it's available, is associated with increased rates of exclusive breastfeeding at time of discharge. And this is important because mom's own milk is the best for her baby. One of the most devastating conditions that can affect premature infants is necrotizing enterocolitis, NEC. The March of Dimes reports that about 380,000 babies are born prematurely, and that's less than 37 weeks of gestation each year. That is 9.8% preterm, 9.8% preterm birth rate, or 1 out of 10 babies are born too soon. NEC is a serious gastrointestinal condition that affects premature babies, and it has a high mortality and morbidity rate. The condition in neck, what happens in the baby, it inflames the intestinal tissue, which leads to bacterial invasion, and it causes the tissue to die. Holes or perforations form in the baby's intestine, and those perforations then allow bacteria to leak into the abdomen or bloodstream, and that leads to peritonitis, sepsis, and even death. Infants who survive NEC may develop short bowel syndrome because surgery may be an interaction to help the baby. Short bowel syndrome makes it hard for the baby to absorb fluids and nutrition. Children with short bowel syndrome need lifelong care to get the needed nutrition to grow, and some require tube feeding. So this chart shows you some of the benefit effect of pasteurized donor human milk related to necrotizing enterocolitis incidence compared to formula, use of formula. So as you see at the top, medical NEC and surgical NEC are lower incidence when human milk is used. So when donor milk is used, they significantly reduce the incidence of necrotizing enterocolitis. And it also reduces mortality rate. The other benefit of pasteurized donor human milk is decreasing the length of stay of infants with NEC, and also decreasing the late onset of infection. So as the medical community started to see the benefits of donor human milk, application outside of the NICU is being used and beneficial for newborns. So donor milk benefits well newborns in the mother-baby unit. Delays in milk production can still occur in moms, and when there's a delay in milk production, that can lead to infants experiencing hypoglycemia, hyperbilirubin, or excessive weight loss. Hypoglycemia is a common reason for supplementation in well babies in the first 24 hours of life. And this table demonstrates the effects of donor milk compared to formula feeding and breastfeeding. As you can see, the donor milk provides a nice bump in the blood glucose level in the infant. It's been shown that small amounts of formula in the early days postpartum may alter normal colonization of the gut. And this is where pasteurized donor human milk is beneficial, because the use of donor milk promotes healthy gut microbiome. And I'll touch a little bit on that later on. So outside of the hospital, there's outpatient needs as well. About 25% of the milk dispensed by Humana milk banks is dispensed to outpatients. And typically outpatients are babies with complex medical needs, such as babies who are using pasteurized donor human milk in the hospital and benefit from that post-discharge, so in outpatient use. Babies with cardiac conditions, again, gastrointestinal conditions, and then immune disorders, and even formula intolerance. Pasteurized donor human milk also benefits newborns of HIV positive mothers and adopted and surrogate babies as well. So wanted to talk briefly about the financial impact of premature births and how using pasteurized donor human milk helps reduce the costs. Preterm births is the leading cause of neonatal morbidity and disability, resulting in annual overall cost in the US of about $26 billion. Medicaid finances about half of these healthcare costs. Some of the financial burden can be prevented or mitigated through exclusive human milk feeding. To give you some numbers, full-term birth average cost is about $6,000. When a baby's born premature, the average cost jumps up to $76,000. If a baby's born premature and has low birth weight, that average cost is about $114,000. And then if an infant is born at 24 weeks of gestation, the average cost is over $500,000. So you can see that there's huge costs associated with premature births. So donor milk can reduce the costs associated with length of stay, necrotizing enterocolitis, and sepsis. Analysis of very low birth weight infants in an exclusive human milk diet saved about 3.9 NICU days and a little over $8,000 per infant. NEC, to give you an idea of the cost of necrotizing enterocolitis, is an estimated cost of $5 billion of hospitalizations per year, which is about 19% of the expenditures in the United States. So the average cost of NEC is about $74,000 to $200,000 per infant. And as I said earlier, pasteurized donor human milk combined with mom's own milk, if it's available, reduces the incidence of NEC rates. So the average cost reduction when pasteurized donor human milk is used is about $15,000. When you look at costs associated with non-NEC cases, for each milliliter of human milk fed per kilogram per day in the first 14 days of life saved about $534 in non-NEC related NICU costs. So with all the benefits of donor human milk, where do we get it? Milk banks have many ways to recruit donors. And one thing I want to point out that there's a continuous need for donor milk. For example, my milk bank, San Jose Mother's Milk Bank, needs at least 100,000 ounces of milk donated a month in order to meet the demand that we have with our customers. There are many methods, like I said, that milk banks use to recruit donors. Social media, online searches are probably the most common ways for donors to reach out to us and express interest in donation. We also have collection centers or milk depots, and what these are partnerships with individuals or hospitals or businesses within the community. And what they do is they recruit donors within their community and collect the milk and send that to the milk bank for processing. A third way that milk banks recruit donors is through milk drives. And what these are events hosted by community partners again, and it provides an event for prospective donors who have excess milk to come donate and celebrate their donation. And that milk then gets sent to the milk bank for processing. A quick note about milk drives. Pre-COVID pandemic, so we have a lot of milk drives here in San Jose, or with San Jose Mother's Milk Bank. Those milk drives were in person. And when the pandemic hit, we were all asked to shelter in place. So that really impacted our ability to host in-person milk drives. And what we did is we pivoted and created a structure for virtual milk drives. And that allowed prospective donors to donate their milk from the comfort and safety of their home. Before I get into the processing, how milk is processing, I wanted to cover a little bit about the regulatory bodies that help ensure that the milk that we collect, process, and distribute is safe, make sure that the milk supply is safe. So I mentioned before, Himbana created the standards. They are also our accrediting body. Donor milk banks adhere to the Himbana standards to ensure the safety of the milk from processing through distribution. And accreditation requires annual audits of the milk bank processes to ensure compliance with the standards. And the auditing framework, just to give you an idea of how rigorous it is, we follow the American Society for Quality auditing principles. And that includes auditing all the various documents that you see on the screen there, the food safety plan, all of our standard operating procedures, temperature charts, staff training, donor charts, facility inspection, and calibration records. In addition to the Himbana accreditation, donor milk banks are FDA registered as food manufacturers. We all have developed and maintain a food safety plan to meet the Food Safety Modernization Act guidance, which focuses on the prevention of foodborne illnesses. Additionally, some states require licensing. For example, the state of California classifies donor human milk as a tissue, and they require entities who collect, store, and or dispense donor human milk to apply for and obtain a tissue bank license. So in California, all the hospitals that use pasteurized donor human milk must apply for a tissue bank license. All of our collection centers who collect for us have to have a tissue bank license. So anyone who is within California or collects milk that gets sent to us is required to have a tissue bank license. So on to the process for acquiring milk, processing, and distributing. So the process starts with donor screening. Milk donors are unpaid volunteers, and they must pass a thorough screening process. And that screening process includes a phone interview, which is the initial screening. And that's the first step for us to make contact with the donor and ask initial questions to see if she would qualify to move forward in the screening process. Once the donor is deemed to move forward, we send her a packet that includes medical history questionnaire and forms for their medical professionals, so the mom's physician and the baby's physician, to consent that the mom is healthy and the baby is healthy. We want to make sure that both mom and baby are healthy to qualify them as donors. In addition to that, we test all of our donors for bloodborne pathogens. So we do infectious disease screening tests for HIV, HTLV, syphilis, and hepatitis B and C. All costs associated with donor screening and shipping donated milk to the milk banks is covered by the nonprofit milk banks. One thing to note is not all donors get approved, and some of the hurdles that we see in the milk banking world for reasons why some donors don't get approved is sometimes donors take medications that would defer them from donating her milk. Travel deferrals also is a reason why donors get deferred, and blood draws. So the infectious disease testing, we ask donors to get their blood drawn at a location. And during the pandemic, there was concern about, because there was so much unknown about the virus and we were all sheltering in place, we were concerned that donors wouldn't go out to get their blood drawn. So sometimes the blood draw is another reason why donors don't get to the approval state. So also, we get donors who lose interest. The questionnaire that we provide is very extensive, and there are a lot of questions that we ask, and the reason we ask them is to make sure that not only is the donor healthy, but the milk is free of any components that could be detrimental to the infants that we provide the milk to. And the other reason that we see donors fall off of the screening process is the provider consent. The provider consent is important for us to approve that donor, and sometimes the providers fail to provide that consent of the donors that we're screening. So as you can see, there's many different challenges that we have as milk banks, and we try to make the process as simple as possible so that we can have a higher percentage of donors that make it through to approval. So we accept milk from all donors, and as long as they qualify. This is a picture of our memorial wall. We also accept milk from moms who have lost their babies. So bereaved donors can donate their milk, and milk banks provide moms who've lost their babies a way to help them in their healing process through this milk donation. So this is just a picture of our memorial wall, and many milk banks memorialize these infants. So on to processing. So what happens with the milk once we receive it from the donor? When we receive the donated milk at the milk bank, we inspect each container of milk before we log the donation into our system. And before I move forward, this is just these are pictures of our milk bank, and each milk bank, while they follow the same standards, have different processes to ensure the safety of the milk. The milk is then thawed to prepare it for processing. Each donor's milk then is analyzed for nutrition, specifically fat and protein. And after that initial analysis, we pool 3 to 5 donors into a larger pool. And the reason we do that is we want to even out the nutritional differences that we may see between donors and enhance the variety of the immunological factors that are present in the donor's milk. So for us, we do a final analysis of that larger pool to make sure that the fat and protein values meet the standards. The milk then is dispensed into individual bottles, and those bottles then are capped, they're sealed, and they're ready for pasteurization. After pasteurization, to ensure that the pasteurization process was effective, we pull a random bottle from that pasteurization batch and we send it off for bacterial culture testing. And if a batch shows any growth in bacteria, that pasteurization batch gets discarded. So after pasteurization, just in general, bottles are rapidly cooled, they're labeled, and then they're placed in a freezer that is held at -18 degrees or colder. And that milk then is ready for shipping. So the pasteurization process, we use all the milk banks use Holder pasteurization, and it's been shown to kill harmful pathogens and bacteria. And just a brief overview of what Holder pasteurization is, it's heating the milk to 62.5 degrees Celsius and maintaining that temperature for 30 minutes. And after that 30 minutes, then the milk then is put into an ice bath to rapidly cool, and again put into freezers at -18 degrees Celsius. So the benefits of Holder pasteurization, it maintains many of the beneficial components in human milk. And even though there are some effects to the milk during the Holder pasteurization, there's still a lot of components that are maintained. So to show that, this chart shows you comparison to mom's milk, pasteurized milk, and formula. Not all the components, but a few of the major components that still remain after pasteurization. For example, the secretory IgA antibodies, 70% of those are maintained in donor milk after pasteurization. The secretory IgA's main function is to inhibit pathogens from attaching to the GI epithelium. And what that does, it prevents bacterial colonization and neutralizes the bacteria enterotoxins. So it keeps the bad bacteria out of the baby's guts. Another valuable component is the oligosaccharides, the human milk oligosaccharides, HMOs. How they're used in the body is they improve immunity, they provide better gut health, and improve nutrient absorption. So the oligosaccharides are beneficial for the good bacteria, and when there's more good bacteria, they're able to combat the bad bacteria in the infant's gut. So a quick note about lactoferrin. It's an iron transport protein in human milk that has also bacteriostatic and bactericidal activities. And as you see here, 40% of the lactoferrin is maintained in donor milk post-pasteurization. Formula derived from cow's milk has much lower amounts. Even though it says 0%, it's significantly less than what's in human milk. And soy-based formula products don't have any lactoferrin contained in them. Another component not listed on here is it's called milk fat globule membrane, MFGM. It has many bioactive components that are linked to positive effects on neurodevelopment of the infant and defense against infections. And it's found in donor milk or human milk, and it's not found so much in formula. So these are some of the major components that are beneficial for the infants. So a little bit about COVID-19 and the impact to the milk banking world. As I mentioned earlier, early shelter-in-place restrictions really caused a concern for milk banks. Our concern was we would lose donors, or donors wouldn't donate. We wouldn't get the milk into the milk bank to be able to supply to the hospitals or outpatients that we support. Um, we did get some donors who were reluctant to get their blood drawn, and milk banks pivoted, as we all did, to be able to do what we do during the pandemic. Some milk banks provided mobile phlebotomy services so that these donors could get their blood drawn. I talked about creation of virtual milk drives, which was beneficial for milk banks also. Again, we tried to make the donation process as simple as possible, working around the pandemic and the restrictions that we had to follow. Some milk banks picked up milk at the donor's home. So there were many different tactics used to make sure that that we got the milk we needed for the babies in the hospitals and outpatients. Early in the pandemic in 2020, a group that included Himbana representatives, CDC, NIH, the WHO, UNICEF, and others got together, and what they did is they provided data and guidance on how to respond internationally to the continued threat of COVID-19 for mothers and infants. Also, the Global Alliance of Milk Banks and Associations was formed, and many members across the globe got together, and what they did is they published a paper in 2021, and that paper confirmed that human milk does not transmit COVID-19 virus. In addition, the pasteurization process also was proven to kill the SARS-CoV-2 virus, the virus that causes COVID-19. So I wanted to end with just a perspective on the potential for more donors. When you consider the number of prospective blood donors, anyone from 16 years and older can donate blood, so it's a huge donor pool. The number of prospective milk donors is much smaller group, and blood donors can donate every 56 days. Oftentimes, our donors are first-time donors, and sometimes they donate once and they're done. Just to give you some perspective, in 2020, the female population of 20 to 39-year-olds, and I use that because that's the average age group of our donors. There were over 44 million women in the U.S. and 3.6 million births in the U.S. in 2020. Looking at California, there are 5.5 million women ages 20 to 39. There were 420,000 births, just over. And in 2020, we had 2,742 donors. So of those women who gave birth, those 422,000 women who gave birth, we got 2,742 donors. And we recognize that not all women have excess breast milk to donate, but if we could increase that just a little, it would be a significant amount of milk for us to have for the babies that we serve. So the first line of defense is a mother's own milk. It provides benefits in terms of nutrition, immunological support, and protection from complications. And while donor milk can compare to mom's own milk, it does offer cost benefits that I demonstrated. And it also increases the exclusive maternal breastfeeding success as well. Comprehensive lactation support and educational programs on appropriate use of donor human milk is an effective way to reduce complications and improve long-term outcomes. Donor milk is a resource that can be optimized to improve outcomes and reduce costs for selected infant populations. About safety, Himbana accredited milk banks follow strict standards to ensure the milk we collect, process, and distribute is safe for all infants. And as I said earlier, demand continues to increase, and milk banks need to continually recruit donors to meet the needs of the fragile and sick infants in our communities. And if you have worked with a milk bank before, fantastic. If not, contact your local milk bank to support their efforts in raising awareness, in recruiting donors, hosting a milk drive, establishing a milk collection depot, or any way to get the word out on milk donation. We are always looking for ways to recruit donors to make sure that we have the milk available for the infants that we support in the hospitals and in outpatient settings. And that concludes my presentation. Thank you all for attending. And I think are there any questions?
Thank you, Jonathan, for presenting that great information. We do have some questions that are coming through, and we do have some time to answer those. So if you do have a question, feel free to enter that in the questions panel, and we'll try to get to all of them that come in. The first question that came in is, do donors of donor human milk get paid to donate?
So the donors that donate to the Havana milk banks are all volunteer donors, and they don't get paid.
Okay, thank you for that. The next question is the milk screened for illicit drugs?
In the screening process, in the questionnaire, we do ask questions about illicit drug use. And we do defer donors who are taking illicit drugs.
Okay, thank you for that. The next question is, are the NEC outcome rates based both on Canada and the US?
So the NEC rates that I provided are US rates.
Okay, thank you. The next question is, does Habana work with hospice centers or other groups outside of NICUs to let grieving families know they can donate their milk?
There's always opportunity to work with different groups to inform them about milk donation. We work with a lot of our hospitals who use our milk, and they recruit from their own patient base. So if there are other groups that we could reach out to raise that awareness, we're always open to increasing that connection within the communities.
Okay, thank you. The next question is, how much is an ounce of milk cost? Just to give us an idea, and who pays for the babies in the nursery?
So the cost of milk, it varies from milk bank to milk bank, and the cost covers the processing. So if you remember, milk banks pay for the cost of the infectious disease testing, the shipping. So all of that is tied into the processing costs associated with the milk. In the hospital setting, milk is charged as part of the service provided to that infant. And in outpatient settings, some insurance companies do cover the cost of milk.
Okay, thank you for that. The next question is, can a woman drink alcohol and donate still?
So there are guidelines to donating. We do ask the question about alcohol consumption. We even drill it down to the amount of alcohol consumed and the time from the alcohol was consumed to the time the milk was pumped. We do tell donors not to donate milk if they were consuming alcohol during the time that they were pumping her milk.
Okay, thank you for that. This kind of goes along with the drug screening question. This person is asking if marijuana is considered an illicit drug by the milk bank.
We do ask questions about marijuana use.
Okay, thank you. There's a couple of those types of questions coming in. What disqualifies a mother from donating?
Oh, there are many reasons. Probably the most common reason that we run into is use of certain medications. Part of the standards, the Habana standards, includes a medications list, and that medications list is very extensive, and there's a lot of medical research behind the deferrals associated with medications. So while I can't give specifics, medication use is probably the most common reason that donors get deferred. Travel is also a reason for deferral, and here recently, the blood banking world actually removed the travel restrictions or the restrictions associated with VCJD and CJD. And the milk banking world also removed those restrictions. So hopefully removing those will increase the number of prospective donors that can donate milk.
Okay, excuse me. There was a question about where the list of these medications that mothers should steer clear of if they want to donate is or can be found.
So it's part of our standards, and the standards are proprietary and used mainly for milk bank use.
Okay, thank you. Someone is asking if you have a flyer available that can be posted in their pediatric clinic.
We do. And if I could get the contact, I'd be more than happy to connect and send some flyers.
Would you like to send that to me, Jonathan, and then I can include that when I send out a follow-up email after the webinar?
Absolutely, absolutely.
Okay, perfect. So I'll
Yeah,
provide that to everyone.
great. Yeah. We actually have two flyers. One is just a quick trifold to educate on milk donation, and then the other is another trifold, just briefly describing the benefits of using donor milk. So one's a donor focus, the other is a recipient focus.
Thank you for that. The next question is, can patients purchase directly from you, such as those who don't have insurance that would cover it?
Yeah, so in the outpatient setting, just to give you some statistics, 60% of the milk that we process and distribute is provided to hospitals, and the remaining 40% goes to outpatients. And the way the outpatient ordering process works for us is the outpatient fills out an online form. We reach out to the family and confirm their order, and and then ship that milk. One thing to note for outpatients, and this is true for all milk banks, is we all require a prescription. So working with the pediatrician is very important to make sure that we get that prescription for that infant.
Okay, thank you for that. The next question is, do typical NICUs have inclusion and exclusion criteria, or do all babies receive the milk?
So each NICU has criteria for use of pasteurized donor human milk, and it varies from hospital to hospital.
Okay, the next question is, how often do batches of processed milk have to be destroyed after culturing?
I can give our statistics. So we actually track what we call our yield, and what the yield indicates is what percentage of the milk that comes in is actually usable. And our yield to date is about 97%. So 97% of the milk that comes in, we're able to use and distribute to our recipients.
Great, thank you. We do have a lot of questions, as you can see, Jonathan, that are coming through, so I'll just keep firing them off to you if that's okay. The next question is, I am an IBCLC at a hospital in Maryland, and we use donor milk in the NICU. how can I promote use for our full-term babies that require supplementary needs?
Oh, that's a great question. We in California, we're actually seeing more hospitals expand the use of donor milk outside of the NICU into their well baby nurseries, and a lot of it is really based on education, educating the physician, and really getting a physician champion to push that need for using it in the well baby nurseries. I don't have an exact formula for getting that done, but getting a champion, a medical professional champion, I think will be key in getting that accomplished.
Okay, thank you for that. Someone is asking if you can please clarify those travel guidelines and what the acronyms stand for.
Can you ask that again?
Please clarify the travel guidelines. What do those acronyms stand for?
Oh, the CJD and VCJD, I'm
Yes, I
assuming.
believe that's what
Yep.
they're
Uh,
referring to.
that refers to the mad cow disease. So uh, the, the name just escaped me. I'll have to look it up. But anyway, it is related to the mad cow disease. So I apologize that I can't remember the acronym.
If you want to provide those to me, I can certainly give those to people when I send the follow-up email. That's fine.
It
Oh,
What would we do without technology?
yes.
So the CJD stands for Creutzfeldt-Jakob disease, and the VCJD is the variant Creutzfeldt-Jakob disease.
Okay, thank you.
Yeah.
Gotta love Google, right? The next question is, how much physical space would a hospital need to have a milk donation drop-off site?
Oh, so really so there are requirements related to the collection site or the depot. Number one is space for a freezer. And the size of the freezer is really dependent on how much milk that collection center could potentially collect. The other requirement, and I'm just giving broad strokes here, the other requirement is either the freezer has to be lockable or in a secure area. And the freezer also has to be monitored for temperature, maintenance associated with that also. So it really depends on the available space at the hospital. The one example I have, we audit our collection centers annually, similar to us being audited, because we want to make sure that the collection centers are following the same guidelines in collecting milk as we do. Um, One of our collection centers is in the hospital in a room that's maybe 10 by 10, and it has other purposes also, but the freezer is lockable, so that meets the standards for that freezer. So definitely work with your local milk bank to see if that's something that they can help provide guidance on to help establish that collection site.
Great, thank you. The next question, we have a couple of them that kind of go along together. Do milk banks supply pumps and or pumping supplies to the moms donating?
That's a great question. So I can talk about us. So we do provide pumps, and one of the benefits of that is it's been shown that moms who are discharged with a pump have higher success in achieving exclusive breastfeeding rates. So we actually work with a couple of our hospitals and provide pumps for their Duraco medical equipment closet, and they issue those pumps to their moms. So I can't speak for all the milk banks, but for us, we do provide pumps.
Okay, thank you. The next question is, how long after birth do you accept milk for milk banking?
That varies also. We have some milk banks who accept milk from moms 12 months post and others have a shorter time frame. What we ask here is based on the lactation date. Um, the milk, and I didn't touch on this in the manufacturing process, but the expiration date of milk is 12 months from the earliest date of milk expression. So if a mom expresses milk on January 1, that milk that was expressed is good for 12 months. So it expires at the December 31st of that year. So we asked to have moms ship milk to us no older than 9 months old. And the reason that is once we receive it, we have a very short amount of time to process it and distribute it for use. So you can see why with that 12-month time frame expiration date, we want the freshest milk as possible, but we will accept milk that is uh, less than 9 months from the date of milk expression.
It's good to know. The next question is are there times that a baby rejects donor milk?
I personally have not heard, but um, I don't have personal experience on that. I yeah, I'm not sure.
Okay, fair enough. The next question is, our NICU has issues with low sodium in donor human milk. Is that a common issue with donor milk?
So I haven't heard that. We provide to about 80% of the NICU hospitals here in California, and I haven't received feedback on low sodium and the impact to the infants.
Okay. And I know you went over the compensation that mothers that donate to your milk bank are not compensated,
Correct.
but someone is asking how much compensation is. So is that across the board that usually they do not compensate for donations? They're just free of charge donations?
Yeah, it's so um, a lot of the questions and processes that the milk banks use were modeled against the blood banking industry. And similar to blood donors are volunteer donors, they don't get paid. Likewise, milk donors for all milk banks, all Himbana milk banks, nonprofit milk banks, the donors are all volunteer and not paid for their donation.
Okay, thank you for answering that again. A few more minutes before top of the hour. So this question is, I have a patient who would potentially use donor milk, but asked if the donor received the COVID-19 vaccine. Only one patient to date has declined using donor human milk, not knowing the donor's status. Is COVID-19 vaccine a screening question typically that you ask?
So when the pandemic first started, and there was so much unknown about the COVID-19 virus, the milk banks added questions to the health history questionnaire related to COVID illness. We don't ask specific questions about vaccine for the COVID vaccine, but we do ask some questions related to COVID infection.
Okay, thank you. One question is coming back asking about the cost of the donor human milk. Um, what is on what is it on average, and is it for just your area or is it across the board approximately?
Yeah. So I don't have what other milk banks charge for their milk, so I can't give an average without knowing that information.
Okay, thank you.
Mhm.
I'm just trying to see if we've got we'll do this the last question. What is your opinion on giving raw donor human milk like in Norway?
Um, So in the U.S. And I'm sure other parts of the world, there are milk sharing groups, and we recognize that moms, want to support each other in providing milk to their circle of contacts. Um, the one thing to note is that Habana milk banks follow a very rigorous process to ensure that that milk is safe. We do the health history screening, we do the infectious disease screening, and it provides assurance that that milk is is devoid of any harmful substance or pathogen that could be harmful for the infants in the NICU and any ill infant. In milk sharing situations, moms are the milk and the mom aren't screened at all or tested, so there is that risk of safety of that milk being provided, shared with other families. So that's something that with that information, there are options obviously, but know that the milk received from the milk banks, Habana milk banks, goes through that screening process and the pasteurization process to make sure that that supply is safe.
Great, thank you. Looks like we are at the top of the hour already. This hour went very fast. Thank you, Jonathan, again for presenting for us. Just a reminder, your certificates should be available Friday by logging into your account. And registration is open for our August 17th and September 14th webinars, as well as a special webinar that we will be having that does not offer CEs, but will be a product update webinar at the end of August. That registration will be open soon for that. And you can register for the 2 webinars at medilaeducation.com. And right after we end this webinar today, a separate window will pop up for the evaluation. So make sure you fill that out to get your CE for this hour. And thank you everyone for joining us today. And again, thank you, Jonathan, for that great information. We appreciate it.
Thank you so much for
Enjoy
having me.
your afternoon. Thank you.